Hi, my name is Zaina, and today we're going to be talking about sleep and more specifically, the relationship between sleep and stress. Before we get started, I'll briefly introduce myself and give an overview of what we'll focus on for the next hour or so. I'm a licensed professional counselor and completed my schooling at Wayne State University. I have a bachelor's in nutrition and food science, a master's in community counseling, and recently completed a PhD in counselor education. I have an interest in the relationship between mental and physical health from my schooling and just personal experience. And my dissertation research was a randomized controlled trial on the topic of stress and sleep quality. So this is a topic I've spent a great deal of time researching the past few years, and I'm very excited to be sharing this information with you today. Why is sleep important? This is one of the topics we're going to talk about today. First, we're going to take a look at why sleep is important, define sleep, briefly look over why we sleep, and some consequences of sleep deprivation. And we'll look at the relationship between sleep and stress specifically, because the relationship between sleep and health is very broad and we have a limited time. We're going to focus more specifically on sleep and stress. And then next, we're going to go over what to look for in clients, what are some symptoms of poor sleep quality that you may want to address. And then lastly, we're going to explore some sleep interventions that can be helpful to both clients and clinicians, and take a look at sleep as a tool for stress reduction. So why is sleep important? Why should you as clinicians consider the sleep of your clients? Well, I'm going to give you a few reasons and also share with you some statistics. So research has shown that improving sleep quality leads to better mental health. And so specifically in one meta-analysis of randomized control trials, and this was 65 trials comprising 72 interventions and a little over 8,500 participants. It was 8,600 participants, so even larger, found that improving sleep led to significant effects on mental health. And so there was a significant medium effect size effect on mental health and depression. So there's an improvement there. There was also a significant medium-sized effect on anxiety. There's a significant small to medium-sized effect on stress, and this is what we're going to focus on today. And there was also statistically significant effect on psychosis, although it was a small effect. And I think it's important just to briefly define sleep and talk about some main components. Sleep is very important, of course, for maintaining mental, but also physical health. The two go hand in hand. And sleep involves distinct stages. It's regulated by numerous factors. I'm not going to get into that today, but it does involve a series of physiological and neurological processes that occur in cycles throughout the night. And this includes changes in brain waves, also muscle activity and heart rate. And on this slide is a picture of some key events that occur during our circadian rhythm. And our circadian rhythm is an innate biological process that runs on a 24-hour cycle. It regulates the timing and duration of sleep-wake cycles by promoting alertness during the day and also sleepiness at night. And it influences the production and release of hormones, including melatonin. This is one example, which is involved in regulating sleep. And so disruptions in their circadian rhythm, or rather to the circadian rhythm, can lead to sleep disturbances and also a range of health problems. So I'm going to likely refer to the circadian rhythm throughout this presentation. So I wanted to briefly show you what it is, define it. And so just something important to remember, it is a 24-hour cycle, and it is very important for influencing our sleep-wake cycles. And so when talking about sleep deprivation, it's important to look at quality versus quantity. So although most clinicians, researchers, and also lay people recognize that sleep is important, there still is some debate about the neurobiological reasons sleep is necessary for humans. And what is known more clearly is what happens when humans don't get the proper amount of quality and quantity sleep. So let's briefly first look at sleep quality and what happens when we don't get enough. From what I found, sleep quality doesn't seem to be clearly defined in the research literature. And that means how a person defines sleep quality or quality sleep, it might vary from other people and even within an individual from night to night. But in one research study that compared more subjective sleep quality using self-rating scales versus more objective sleep quality methods like actigraphy, there were different anticipations of what impacted sleep quality, but both objective and subjective found that the biggest determinant of sleep quality upon the day of awakening, so the next day after the individual woke up, was the amount of time spent sleeping throughout the night and the number of times waking up. So those are key factors when determining sleep quality. Is a person able to get through the night without waking up? And also it looks at the time spent sleeping, but that's also part of sleep quantity. So the amount of sleep quantity recommended for each person is averaged based on age. I didn't include every age group, but added sleep quality from ages 6 up. And the source of this information is the National Center for Chronic Disease Prevention and Health Promotion. So you can see here that there are different recommended amounts of sleep from school-age children to those who are teens, and then also for adults. Most recommendations I've seen are between 7 or 7.5 to 9 hours a night for adults. And so what are the consequences of sleep deprivation? And a lack of sleep quality and also sleep quantity results in sleep deprivation. And there's many consequences, but we're going to take a look at some common ones that impact physical health, cognition, and also mental health. Looking at physical health, there's several. I picked a few common ones, and there's an increase in pain sensitivity, a decrease in immune function, an increase in the risk of diabetes, specifically type 2, and also an increased risk of heart disease for those who are sleep deprived chronically. In terms of cognition, there's an increase in impairments. That should be actually an increase in difficulty with memory, a decrease in reaction time, and also an increase in Alzheimer's. So with all of these different topics and categories, there are both acute and chronic consequences for sleep deprivations for all. And then lastly, looking at mental health, there's an increase in stress, anxiety, when we are sleep deprived, a decrease in positive affect, an increase in depression, and also an increase in loneliness and isolation. So I want to show you a couple of graphs that show some statistics to really point out why this topic is so important. This picture is taken from the Center of Disease Control and Prevention website. And It looks at short sleep duration is defined here. Or I'm sorry, rather, it looks at the prevalence of short sleep duration among all United States adults by state, and this is from 2020. Short sleep duration is known as less than 7 hours, so I haven't seen any recommendations for less than 7 hours of sleep. And so this is within a 24-hour period, so it may include naps as well. So as long as that individual receives less than 7 hours of sleep within a day. And if you take a look at Michigan, you can see that Michigan has one of the highest prevalences of short sleep duration in the country. And it's about 37 to 42.8% of all adults. This is very high. And again, I point this out because you are very likely to be working with clients who are sleep deprived and who are experiencing some sort of consequences of not getting enough sleep. I also wanted to show you this chart briefly. This is looking at the prevalence of short sleep among high school students. And so you can see here that it still is very high as well. Okay, so now that we have established that sleep deprivation is definitely an issue, it's something that is important for all those working in healthcare in some form to be aware of. I want to focus a bit more on the relationship between sleep and stress. And I chose to focus on stress because, like sleep, it is something all humans experience. And there's also a clear bidirectional relationship that's been established between stress and sleep in the research literature. So meaning high amounts of stress can impact sleep negatively, and sleep deprivation can negatively affect stress. So there's definitely a relationship between the two. They go hand in hand. And so let's take a look at a few reasons how stress can cause sleep deprivation and lead to it. So I have here the citations if you'd like to read the research more. I base this on some studies that I read. And so one reason is there's a decrease in neurotropins. And so sleep deficiencies may cause a decrease in neurotropins, which have a role in stress regulation. And so a common one called brain-derived neurotrophic factor, or BDNF. BDNF is a protein that acts as brain fertilizer, and it facilitates neuroplasticity and also provides nourishment to brain cells. So it's pretty important for cognition and a lot of other brain activities. BDNF levels may be impacted by sleep, and one study found that stress can decrease sleep, of course. We know that, but it can in turn decrease BDNF. So that's the relationship there. One more reason is that there is an increase in HPA axis activity. So on a physiological level, a lack of sleep quality can lead to an increase in HPA axis activity. And this is known as hypothalamic pituitary adrenal axis, which we have pictured here. And this causes an increase in the stress hormone cortisol, plays a big role in the HPA axis. And so this goes against the circadian rhythm's natural tendency for cortisol levels to decrease right before bedtime. So if we have an excess of cortisol, it's going to have difficulties with sleep. So really, the role that the HPA axis plays, really sleep deprivation can increase stress in that way, and also vice versa. So This reason acts for both ways in the bidirectional relationship. So let's look at a couple reasons how stress can increase sleep deprivation. And number one is an increase in amygdala activity. And so the amygdala, it plays a role in the processing and regulation of emotions. Overactivity of the amygdala has been associated with a heightened emotional reactivity, and this can lead to high stress levels. You can see here the amygdala is located here in the temporal portion of the brain. Sleep decreases amygdala activity, and especially during REM sleep. So sleep deprivation can increase stress levels in this way. And then another mechanism involves pre-sleep arousal, or PSA, and cognitive contributors to PSA involve some worrisome thoughts, rumination, and some examples of maybe more somatic causes could be like faster heart rate, muscle tightness. PSA might also contribute to sleep deprivation due to an increase in sleep onset latency, so pushing back the time that an individual goes to sleep, and cause disruptions during sleep as well, or also insomnia, of course, because we're delaying when sleep occurs. And so just a quick preview of some things we're going to talk about, but cognitive behavioral, sometimes mindfulness sleep techniques may reduce PSA and in turn reduce sleep disturbances. We're going to talk a bit about that further on in this presentation. And so we're about halfway through, and now that we took a look at why sleep is important and also how sleep deprivation impacts mental health, specifically stress, let's take a more practical approach for this last half and talk about symptoms of poor sleep quality. You may notice in your clients, and then after that, we'll touch on some techniques to improve your sleep quality and your client's sleep quality. These are some symptoms you might look out for when working with clients. You might gather this information, for example, during an intake, or note if the client brings this up in conversation, or maybe you notice physically some symptoms of sleep deprivation. If the client brings this up, or you might point this out and ask. Of course, keep in mind that the mental health condition also could be impacting sleep. So there's that bidirectional relationship, not with sleep and stress, with sleep in many mental health disorders. So this is something important to keep in mind, because in some cases, just working on improving sleep might be very difficult for clients who are managing certain mental health conditions. So it's important to definitely have a more clear understanding. I'm of course being very broad with this talk, because I can't go into every single mental health disorder in this short period of time. But I just wanted to point this out, that it's important to take that into consideration. So let's look at, I'm going to bring up about 7 symptoms. And insomnia is very common. And it's known as difficulty falling asleep or staying asleep. And according to the American Academy of Sleep Medicine, approximately 30% of adults in the United States report symptoms of insomnia. It might even be higher in Michigan. And about 10% of adults in the United States on average meet the criteria for a diagnosis of chronic insomnia. So this is something that is very much a hindrance in clients' day-to-day life. And of course, what symptoms they present might be very different. So The next one I want to talk about is feeling excessively sleepy or fatigued during the day. And I think some of these are pretty obvious, but clients who don't get enough sleep at night, of course, might feel drowsy, sluggish, unable to stay alert during the day. Some things you might look at is if clients mention they struggle to concentrate, they have difficulty remembering things, experience decreased productivity at work or school. It's been found that people who experience sleep deprivation may show symptoms very similar to ADHD. So it's important to really understand how a client is sleeping, because they may present with a lot of mental health symptoms that are actually because of sleep deprivation. And if their sleep is improved, those symptoms might go away. So again, I'm not saying to just treat those symptoms of sleep, but this is something to take into consideration, looking at the client's physical health as well as their mental health. And of course, there's a lot of reasons why people are not sleeping as much anymore. I could go on and on about this. One that I found very interesting, I did a presentation about a couple of years ago, is known as bedtime procrastination. And this phenomenon is fairly new. I think I read an article specifically about the pandemic, and people have been pushing their sleep to a later time, very common among college students, but also people are staying up because they have so much to do during the day. When we had to work online, go to school online, we had often, a lot of us, more responsibilities, so there wasn't as much time to relax. So people were pushing back their bedtime and doing things like staying on their phone, or watching TV instead of sleeping. So it was known as bedtime procrastination. So there's a lot of different reasons. And of course, with the pandemic and when we stayed in all day, that really had an impact on our circadian rhythm. So people were going to bed at different times. And again, the research I've read on when college students are currently going to sleep is just very late, as well as high school students. So again, and people are pushing back their sleep, their time of going to sleep. A lot of it, I think, too, is due to technology. That's something that's heavily studied as well. People are going to bed with their phones next to them, and some research that I've read says that a lot of people who take their phone with them into the bed, they don't remember responding to notifications or alerts, and that can really disrupt sleep and the circadian rhythm, and feeling and having people feel excessively sleepy or fatigued during the day. They might not really understand how much of an impact several things are having on their day-to-day life and causing this. Thirdly, mood disturbances. So clients with mood disturbances such as irritability, depression, anxiety, they may have difficulty regulating their emotions, of course. And this could present in a client as all of these things, feeling irritable, maybe being impatient, intolerant, short temper. They might overreact to irritations that are considered minor for them. So if there's definitely a difference in their behavior that you notice in session, and it could be because they are sleep deprived. Fourthly, increased impulsivity. So clients might act impulsive without considering the consequences of their actions. And of course, this can lead to risky behaviors. So again, as I mentioned before, Sleep deprivation might also mimic some symptoms of ADHD, and one of those symptoms is impulsivity. So, for example, reckless driving may be more enhanced or more common when clients are sleep deprived. Substance abuse, other high risk activities. It really can impair the brain's ability to function, and impairs our prefrontal cortex, where we regulate our emotions and decision making. So our defenses are down definitely when we are sleep deprived. And the thing is that a lot of people don't know that they are sleep deprived. This is actually a quote from sleep researcher Matthew Walker, who wrote the book Why We Sleep. I believe it's called that, or something to that effect. Is that on average, adults are sleeping about 6 hours of sleep per night, which is definitely much lower than the recommended amount. And that would be considered sleep deprivation. And something he says is people who are sleep deprived do not know they're sleep deprived. And it doesn't mean that they're necessarily adapting in a positive way. They just are going to still have those negative symptoms and be dealing with them. So, that's definitely a concern when we're looking at increasing in impulsivity. So you might notice differences and changes within your clients when you're meeting with them, but these could be symptoms that they've been dealing with for a while, if they have been sleep deprived for a longer period of time. And so the next one, memory issues. So memory consolidation and retrieval can be disrupted by sleep deprivation, of course. So there's many different types of memory. I'm talking more so here about the memory that is used to store information that might need to be retrieved. So memory consolidation occurs in the deeper stages of sleep, slow wave sleep, in the third stage. And so during the day, we're absorbing information, and at night we're consolidating, meaning taking the information during the day and converting it into more stable long-term memory. So we have that and can retrieve it in the future. If we're not sleeping and getting the right amount of sleep that we need, then it's going to definitely have an impact on our cognition, our memory. And this can definitely have a significant impact on a person's daily functioning, even if they're not a student, but specifically academic and work performance. And again, this could be very much mimicking symptoms of other mental health concerns. In some cases, it can also lead to safety concerns, so it's definitely an issue. So maybe when in high-risk professions, such as healthcare, transportation, law enforcement, if there's memory issues and it's a high-risk profession, this can definitely be dangerous. And then some physical symptoms. There are many, but some common ones: headaches, muscle aches, gastrointestinal distress can be a symptom of sleep deprivation. So, for example, when a client is sleep deprived, their body might not have enough time to repair and rejuvenate. And this, again, is happening in the deeper stages of sleep, stage 3. This is an important stage where a lot of not only memory consolidation, but also our bodies repair, we rejuvenate. And so, for example, headaches, they're a common symptom of sleep deprivation, and they might be caused by tension in the neck and also shoulders, or changes in blood flow to the brain. and muscle aches and pains are also common. There might be caused by tension in the muscles, or also changes in posture or movement patterns. And a common one, GI distress, is common symptom of sleep deprivation. You notice this in clients. It might show up in a client as stomach pain. It might be cramping. It might be bloating. Sleep deprivation also can cause disruptions to digestion and metabolism. There's hormones that regulate satiety. So leptin and ghrelin are two important hormones, and they can be disrupted by sleep deprivation, not able to do their job. And this can, of course, have an effect, as we mentioned, appetite, weight gain, weight loss. These physical symptoms are significant. If they are significant, of course, any of these symptoms, it's a good idea to refer the client to a physician. I think in any situation where there might be concern for sleep deprivation, so that can be checked out and test run to see if it's not that, if it's something else. And then lastly, an increased reliance on substances, on caffeine, alcohol, or other substances to stay awake or fall asleep is pretty common. And you might notice a client always needing some sort of caffeine. I'm going to talk a little bit more about this later, but it's about a client knowing their limits. And so we're wrapping up the last quarter of this presentation, and I wanted to take a look at some sleep interventions. And some of what I'm going to bring up is geared towards work with your client. Some of it hopefully will be you'll find it to be useful for yourself. I also am going to talk a little bit about my dissertation research, since it is related to sleep and stress, and what the findings were with that. So I think first and foremost, it is important to identify if your client is experiencing poor sleep quality. Of course, your client may tell you this, or you might notice some symptoms, but of course, just using some assessments might be a helpful way to target this. So there are several you can use, but a couple examples that I like is this sleep disturbance short form, which identifies sleep quality, and also the sleep hygiene index, which identifies sleep behavior. So that can give you a good indication of if your client is experiencing some form of sleep deprivation. And then there's psychotherapeutic approaches. So I mentioned a couple a little bit earlier in this presentation. And so, for clients maybe who specifically want to focus on improving sleep, maybe that's one of their goals, or they would like to work on it, if you pointed out. There's some interventions that have been established to be found successful. One of them is cognitive behavioral therapy, specifically cognitive behavioral therapy for insomnia, or CBTI. And so this is a type of therapy that focuses on changing thoughts and behaviors that are interfering with sleep. So again, similar to CBT, but focuses on insomnia. And this has been shown to be highly effective in treating insomnia, and typically involves a combination also of relaxation techniques, sleep hygiene education, and also cognitive restructuring. So sometimes clients, again, might not be aware of the reasons why they aren't sleeping well, and there could be more kind of a solution focused, or it could be their thoughts and their feelings towards sleep. There's many students and clients I've met with that do not like to sleep, and they have they have some beliefs, I believe, that could be interfering with this. And then another one I want to touch on is called mindfulness-based interventions. So MS, MBSR, I'll use, or might refer to it. And so using some sort of mindfulness approaches, and this has been shown to improve sleep quality and reduce symptoms of insomnia. This can include using present moment awareness and non-judgmental acceptance of thoughts and feelings. And this can help clients to reduce stress and anxiety that might be contributing to their sleep problems. So there's a lot of options, and I think that working on sleep can be incorporated into treatment plans rather easily. Another one I actually wanted to briefly just talk about is sometimes known as sleep restriction therapy, but really what this is, I think more as a technique that can be used when talking about sleep hygiene. It involves limiting the amount of time that that person spends in bed, which can help to consolidate sleep and also improve sleep efficacy. So really using the bed for sleep. And so a person should really stay in bed or fall asleep between 5 to 20 minutes of getting into bed. And so kind of working on clients, if they're not falling asleep after the 20-minute mark, they may do some light activities until they feel like they are ready to go to bed. So really making sure that clients aren't using the bed for other types of activities like watching TV, reading, studying, eating, just using the bed mostly for sleep is very important. Light therapy is another thing that can help. It involves exposure to bright sunlight during daytime hours. And this can help regulate circadian rhythms. And this, of course, improves sleep quality if circadian rhythm is running smoothly. This intervention is a lot of times used to treat circadian rhythm disorders, such as delayed sleep phase disorder. And then sleep hygiene is definitely important. And this is the last topic I'm going to talk about. And I'm going to incorporate my research and talking about that too. So sleep hygiene education, it involves teaching clients about behaviors and also environmental factors that can impact sleep quality. This might include recommendations such as avoiding caffeine and alcohol before bedtime, creating a sleep conducive environment, maintaining a consistent sleep schedule. So I'm going to go over the sleep hygiene techniques I used in the research intervention I created. But keep in mind, there are a lot of different techniques. So this research, though, I'm going to talk a little bit about it and then go into the intervention design. But this research targeted undergraduate university students. I chose this population because they notoriously have difficulties with sleep. And this intervention was facilitated virtually using Qualtrics as the platform. And this was Qualtrics randomly assigned participants to either an intervention group, which had 49 participants in total, or a control group, and there were 59 participants. So it was truly randomized. It was a bit of an uneven number. The intervention group received behavioral sleep education intervention. And it was about, all in all, a 90 to 2 hour intervention. So too long to go over fully in this presentation, but it was self-paced. And the intervention group received 3 out of the 6 sleep hygiene modules I'm going to go over in a moment. They were randomly assigned to them. And so when I say module, I mean just a grouping of information. There is a video. There was some supplemental information. There was also some intervention, or I'm sorry, not intervention. There was also some goal setting that the client did too, how they're going to specifically improve their sleep using the sleep hygiene technique that we discussed in the module. And so I'm going to give just a quick sleep hygiene technique for each as an example. Okay. So again, I'm going to talk about, won't talk about the first one. This was just talking about habit building, because I think when talking about sleep hygiene or improving sleep in general, it's important that clients, students, any individual has a solid foundation on how habits are formed. And so nutrition was one of the modules, one of the 6 sleep hygiene modules. And so one tip I have for that is to limit caffeine for at least 6 hours before bedtime. And so even if a person's able to fall asleep, there's a study that showed that ingesting caffeine can still compromise sleep quality, because a person won't be able to get into the deeper stages of sleep. So remember, we talked about those deeper stages of sleep are crucial for tissue repair, memory consolidation, lots of important things. So if an individual is consuming caffeine within 6 hours before bedtime, even though they might be able to get the amount of sleep quantity, maybe they're getting 7 to 9 hours of sleep, they're not getting the amount of sleep quality. And so that very likely that they are not. So that is definitely going to be an issue. And so making sure clients are aware of that, and they know that there's even caffeine in chocolate, for example. And so 6 hours is really the minimum amount. Some people who have more sensitivity to caffeine, they may need to cut their caffeine even earlier. Exercise was another module. And so incorporating regular physical activity into a daily routine, even if it's just a brisk walk, like a 10-minute walk, a 30-minute walk. It doesn't have to be going to the gym. So it's helpful because it can help regulate that sleep-wake cycle. And so it also promotes relaxation. It also helps reduce stress and anxiety. And of course, we know that all of these will help improve sleep quality. A lot of the research shows not exercising too close to bed. Although I have seen some conflicting research on that, but I think it's about everyone listening to what works for them. But it's probably best to go with cutting off vigorous exercise 2 hours minimum before bed. And then next, bedtime relaxation. A technique can be really anything that helps the client reduce stress before bed, but isn't too stimulating. So whichever techniques you might go over with them in general. Some of my favorites involve helping put the body into a state of calm first, because I notice some clients have difficulty with this. So progressive muscle relaxation, and then deep breathing I like a lot, because it stimulates the vagus nerve when the diaphragm is contracted, and this leads to a stimulation of the vagus nerve, which helps the parasympathetic nervous system regulation and physically helping reduce stress through the parasympathetic nervous system. And so if a person can first physiologically be in a state of calm, it's oftentimes much easier to then get in a state of calm mentally. And then another one, sleep environment. So I'm trying to give some suggestions that I think are most helpful. But a cool sleep environment is important. It's recommended about 60 to 65 degrees Fahrenheit is ideal. And so that's because our core body temperature naturally drops close to our bedtime. So again, part of our circadian rhythm. If we're sleeping in too warm of an environment, our sleep quality and quantity will likely be compromised. And so one trick is taking a hot shower bath right before bed. This can help decrease our core body temperature because of the contrasting temperature from being in the shower, the bath, and getting out. This is going to cause our core body temperature to drop in that way. Having a sleep schedule. So establishing a consistent sleep schedule by going to bed and waking up at the same time every day is important, even on weekends. And this can help regulate, again, our body's internal clock, our circadian rhythm, and therefore promote better sleep quality. The fact that we have a circadian rhythm is one reason why we can't fully make up sleep debt by oversleeping on the weekends. Because we still have our circadian rhythm doing what it does at certain times during the day. So, our sleep debt cannot fully be made up. And then lastly, the last module and sleep hygiene topic I'm going to talk about is bedtime routine. And so this, of course, works in a similar way to having a sleep schedule. By establishing a consistent bedtime routine, we can provide our bodies with consistent and predictable cues. This is important. And this can help signal when it's time to wind down and prepare for sleep. And so again, a bedtime routine can do so many things, help create a sense of calm and relaxation, help reduce stress, promote sleepiness, and engaging in activities like we mentioned, taking a warm bath, reading a book, of course, not using bright lights and not reading in the bed, practicing relaxation techniques. We can help calm our minds and also bodies, and then promote, of course, a restful sleep. So this was an overview of the intervention design in the research. And then just to wrap up talking about the study, I wanted to briefly bring up the control group. So the control group, they also received an intervention, but they received 3 modules. It was not randomized. The modules that they received did not encourage any sort of behavior change or mention any benefits of sleep. Instead, the focus was on just facts about sleep. So, for example, the history of sleep was one module. The sleep cycle was another module. Of course, not talking about any of the benefits of sleep within the sleep cycle, and then also dreams. And this was the same amount of time as the behavioral intervention, but it just did not have any sort of behavioral change or kind of suggesting that participants engage in any sort of behavior change. So this intervention was given, took about 90 minutes to 2 hours. And then there were follow-up assessments given to all participants, and they compared the assessments before the intervention and then 2 weeks after the intervention. So as for the results, at baseline, so before the intervention and post-intervention, both groups completed the measures and kind of quantified the dependent variables. The dependent variables were perceived stress. This was measured by the perceived stress scale, 10 item. Sleep hygiene was another variable, and this was measured by the sleep hygiene index. And then sleep quality was the last variable, dependent variable in the study. And this was measured by sleep disturbance, short form 8B. And the results demonstrated that participants in the behavioral sleep education intervention had lower perceived stress, more productive sleep hygiene behavior, and better sleep quality post-intervention compared with participants in the control group. And so the effects were also medium effect size, at least for stress. And then there was a large effect size for sleep hygiene and also for sleep quality. And all of the results were statistically significant. So therefore, this suggests, the results suggest by helping improve sleep hygiene using an education intervention, perceived stress levels may decrease as well. All right, so this will conclude this presentation. I do hope that you found it helpful. I have here a list of references if you would like to read more about some of what I referred to, and also some resources that you might find helpful for you as well as your clients. So thank you very much and take care.